So in October 1987, the First Lady of the United States, that's Mrs. Nancy Reagan, she underwent a screening mammogram. The mammogram reported a lesion which is very small, too tiny to be picked up on clinical examination by any doctor. They tested her more and they said it was cancerous. Even though she had the option of sparing her breast, she decided to have her entire breast removed. Because the lump was not felt even on clinical palpation by the doctors, what they did was they put in a wire under mammographic guidance, that is stereotactic guidance, into the lump. They took a check x-ray to see whether the wire was inside the lump that they saw on the mammogram. Then they took her in the OT, in the operation theatre, went around the wire, removed that lump, sent it to the pathologist for frozen section. The pathologist confirmed that it indeed was cancer, and within 20-30 minutes the report was given to the surgeon, and the surgeon went ahead to remove the entire breast. Luckily, it was stage 0 cancer, what we call it as DCIS, that is ductal carcinoma in situ. So stage 0 breast cancer has no impact on survival. It does not threaten your life. So do we see that Mrs. Nancy Reagan went on to live full 20 years after she was discovered with breast cancer, till 2016 when she died because of other causes. This story is important because it also emphasizes that early detection can improve outcomes enormously. Because the lump was less than a centimeter, it was around a 7 millimeter lesion, and it was DCIS, she did not require any chemotherapy or radiation, and just hormonal tablets for about 5 years, and that kept her alive for almost 20 years. In the US, presently, because of a standard screening mammographic program, 40% of the lumps are detected at a stage when it is not even felt by the doctor or by the woman or by the patients. The patients, women, undergo regular annual mammographic screening more than 40 years of age till about 70 years of age. And the insurance would not cover you if you didn't have your mammogram done the previous year. In the UK, the NHS has mobile mammographic vans that goes around into the streets, stays there for that area, and the women in the area are invited to have their mammos done. Now this program has been running for the past 20-25 years, that these countries have the entire database of mammograms of all the women in their country, that now they've come to a conclusion that they may not need additional mammograms every year, and they've defaced it out to once in 2 to 3 years. In India, we are quite far behind this scenario. Because breast cancer was not so common and cervical cancer was more common, our screening programs focused on cervical cancer. But the recent Globacon data 2018 that was presented by the WHO and IARC in the Korean Cancer Congress in September declared that breast cancer is the most common cancer in India amongst both men and women put together. So it's high time we wake up to the epidemic of breast cancer and take initiatives to prevent it and avoid risk factors. Now what can we do about it? So we need to be aware of the risk, we need to get screened, we need to adopt measures to reduce the risk and adopt healthy lifestyle measures. So coming to the risk factors for breast cancer, in 80% of the women, there is no risk factor found except that of gender. So yes, gender is a risk factor for breast cancer. Being a woman is a risk for breast cancer. But that does not mean that men do not get breast cancer, but it is rare in men. But 1% of breast cancers can occur in men also. Increasing age is again a risk factor. So as your age increases, the risk for breast cancer also increases. The other risk factors are mostly related to your hormonal and menstrual cycles. So having an early menarche or having your periods early, or a late menopause, having no children at all, or having your first child after 35 years are all risk factors for breast cancer and increase the risk for breast cancer. Incidentally, having more than 4 children seems to reduce the risk for breast cancer, because most of the majority of the breast cancers are hormone dependent. Other risk factors that we need to know about it is, yes, obesity. So obesity or excessive weight, especially in the postmenopausal subgroup, is a risk factor. So physical activity, diet and alcohol are interrelated risk factors. So out of the risk factors, there are something called as modifiable risk factors and some unmodifiable. So the modifiable risk factors are such as use of hormonal therapy such as oral contraceptive pills or hormone replacement treatment, diet, alcohol, obesity, and planning your family, like delaying delayed childbearing or age of childbirth more than 35 years. Unmodifiable risk factors, yes, gender is unmodifiable, age is beyond your control, genetic history, 10% of breast cancers can be hereditary, again over which we do not have any control. So once you know the risk factors, what else can be done? So if you fall into the high risk category, there are some steps that we can take to reduce our risk. The second step is to be aware of your breast. So breast self-examination is the first step. For screening purposes, a clinical breast examination by a breast cancer specialist and a mammogram is in vogue. So at least a yearly annual checkup with a breast specialist and mammogram is warranted for all women more than 40 years.